Hello, my name is Rhonda Brune. Today I'll be discussing prescriptive authority for nurse practitioners. Advanced practice nurses, also known as APNs, are regulated by the state in which they work, which determines their scope of practice and prescriptive authority. While physicians universally enjoy the least restrictive scope of practice regulation, APRNs have more variability on autonomy and authority. Restrictions placed on APNs not only limits the practice capacity of the nurse, but also severely impacts populations who are underserved and promulgates the shortage of mental health providers in rural areas. So if we could go to slide 2, the definition. Currently, 22 states allow APNs full practice authority, permitting prescribing authority of controlled as well as non-controlled medications. 16 states have reduced practice authority, which limits at least one element of the nurse practice scope. 12 states severely restrict practice authority of APNs even further with career-long requirement for collaborative agreement, delegation, or team management. On slide 3, we can see the challenges APNs face. Collaborative agreements serve as limiting factors that are governed by statutory laws and to some extent gives the collaborating physician authority to limit the APN's scope of practice. Collaborative agreements are vaguely defined and poorly understood, thereby increasing misunderstanding of the requirement for a collaborating agreement. Collaborative agreements were implemented to hedge against risk rather than to promote collaborative practice. Although collaborative agreements have existed for decades, most are shockingly vague, rarely addressing more than proximity of practice, availability of mentorship, and of supervision. Collaborative agreements are financially costly, increases administrative burden, and decreases mental health access. Placing advanced practice nurses who has attained additional education, gained advanced clinical experience, and has passed national certification under the authority of a physician gives an unjustified hierarchical structure, which is misleading to the public and creates inequitable status for the APN, who is an independent provider with recognized national standards for full scope of practice. In slide 4, we will talk about the benefits of PMHNPs who have full practice authority. They have demonstrated twofold increase in the number of patients seen in rural mental health clinics versus their counterparts who have limited practice. Over the last 25 years, APNs have shown improvements in reducing mental health related mortality in rural health. And interestingly, they have shown improved self-reported mental health outcomes for the disadvantaged populations in rural health areas. Also, the Institute of Medicine endorses the skill sets of advanced practice nurses and recommends APNs to have full practice authority. Let's see. The suggested plan on slide 5, we can see that one of the key recommendations for the IOM blueprint for the future of nursing calls for full partnership with physicians and other health care professionals to have full practice authority. Collectively organizing with organizations such as the AANP and the APNA to advocate for political change for full practice of APNs in all states will help secure the advanced practice nurse authority as well as advanced healthcare for rural populations. To address concerns of physician colleagues, consumers, and legislators regarding fewer years of clinical experience of APNs, this writer advocates for a transition in practice internship for a period of 1 year after graduation and successful licensure. Working in a Close collaboration with a mentor will refine interviewing skills, shore up prescribing practices and dosage adjustment skills, as well as offer a sense of confidence for the new APN. This writer also advocates for graduate programs to secure clinical sites and preceptors to ensure a robust and comprehensive learning experience. Most PMHNP programs require their student to procure their own preceptor and clinical site, leaving potential gaps in knowledge and experience that may not be realized until real working experience in a real-world setting. Physician colleagues do not have this stressful undertaking and are able to focus building skills, learning didactic content, and network with other healthcare professionals. In slide 6, advancing healthcare delivery, telemedicine has become a necessity forced about by the COVID-19 pandemic. Studies and data has shown that telemedicine has been demonstrated with patient satisfaction and efficiency when geography would otherwise constrain healthcare visits for rural residents. Telepsychiatry is easily and feasibly streamlined into an integrative care model in rural primary care offices. Questions to discuss are, what is your position on full practice authority? And what are some ways you can address restrictive practice laws that hinder provision of care?